heart palpitations, your heart is racing, you've got pressure or pain in your chest, you run to the ER and they tell you you're fine. Is this you? Has this ever happened to you where you all of a sudden, maybe you wake up in the middle of the night or it happens during the day just out of the blue and your heart is pounding out of your chest and you can't get your breath. And of course you're anxious. Sometimes you have a full-on panic attack. You get to the closest ER or urgent care. They check you out fully and they say you're fine. And you go, great, okay, great. I'm so glad I'm not having a heart attack. And by the way, that's absolutely the right first thing to do, is to get yourself to an ER or get yourself to an urgent care to make sure you're not having a heart attack. It is our #1 killer. But what do you do when you're this person, the person who's been checked out? Not only did you go to the urgent care or the ER, but you went to a cardiologist, you saw your primary care doctor, and they all tell you your heart is fine, you don't have heart disease. So you're very grateful that you don't have heart disease, but it really doesn't give you what to do now, right? Because your heart keeps doing this. After a while, as you pursue this more and more, and I've had patients repeatedly go to cardiologists and go to different cardiologists and have every test known to man, only to be told you're fine. But you go a little too often and all of a sudden they start to look at you a little funny and say, are you under a lot of stress? Because they want to put you in that category, that it's, you know, all coming from up here. And it is not. This is real. You're not a hypochondriac. You're not making it up. You know darn well you're not making it up. But what is it? So that's what this video is about. It's not that you have heart symptoms and you haven't been checked out. You've been checked out repeatedly and you've been told you're fine, but you still have very real symptoms. So I want to go into what's causing it, what you can do about it, and it's all good news. So first of all, what's happening? So a little bit of anatomy. You might notice that sometimes when this happens, your stomach is really full. You have a lot of bloating or gas. You might have overeaten and then lay down at night to go to bed. You might start seeing some correlations. If you're like many of my patients, you've been told that's not related. None of that could cause heart issues. That's incorrect. So we're going to be going through that. So a little bit of anatomy real quick. Your stomach. Your stomach is just below your rib cage, left of center. And what connects that mouth of yours to your stomach is your esophagus. So that's a tube that connects the back of the mouth all the way down to the stomach. And the stomach should be below what's called your breathing muscle, which is your diaphragm. And when you take a breath in, your diaphragm bows down and then you exhale and it goes up. And of course, we hope it's constantly in motion so you never stop breathing. What happens with something called hiatal hernia syndrome is that the stomach gets compressed, and it does so for a variety of reasons, which I will get into, but it gets compressed and so it pushes up on that diaphragm. The stomach and diaphragm are very close to one another normally and naturally, but the diaphragm still has a lot of room to move, which it needs to for a nice free breath in and out. But when the diaphragm spasms, it gets pulled up and it can start to push into the diaphragm. Now, if your stomach pushes above your diaphragm, that's what's called a hiatal hernia. So a hiatus is just an opening or a hole, and there is an opening in your diaphragm for your esophagus to pass through. It has to open through the diaphragm in order to connect to your stomach. But what happens when the stomach pushes up against it or through above it, then the diaphragm kind of spasms. It can't move as well as it should. So when your diaphragm spasms, you can get short of breath because you're not getting that beautiful floating motion of your diaphragm. The other thing that happens is the stomach and the diaphragm right here. What's right above the diaphragm is your heart. So these three organs are very close to one another anatomically, naturally. Your heart has a bit of a sac around it to protect it. So stomach spasms, pushes on the diaphragm elevates a little bit, and now you're impinging upon that sac around your heart. And your heart can start palpitating, racing, flip-flopping, various symptoms that people discuss. It's not heart disease, that's been ruled out quite rightly, but it is impingement, it's bothering the heart, and that's why you can get the heart symptoms. So that's how the anatomy is shifting. But there's other things that happen as well. So I want to talk about your vagus nerve. Your vagus nerve is your longest cranial nerve. It goes to your heart. It goes to your esophagus and your stomach and all your digestive organs. And what happens when you have acid reflux, for one, if you have a lot of bloat or pressure, the vagus nerve gets irritated. And there's a known sort of crosstalk between the stomach and the heart, between the esophagus, the tube, and the heart. So if either of them are irritated, there's a reflex that goes back and forth and can irritate the heart, creating tachycardia, rapid heart rate, the heart palpitations, etc. So we have two mechanisms here. We have a nervous system mechanism, and then we have a physiologic mechanism where things are just shifting because of this pressure on the stomach and the elevation. So there's two reasons you can very much have these heart symptoms that have nothing to do with heart disease, right? Because you're not in that category, but you're still feeling this. So with the vagus nerve, what also comes about is that the vagus nerve directs what's called your parasympathetic nervous system. So you've probably heard of your sympathetic nervous system. That's the fight or flight nervous system. And certainly when your diaphragm is not moving freely, your nervous system goes into fight or flight because it's sort of in red alert mode, like, you've got to do something. And as it's saying, it's secreting a lot of stress hormones. And so those stress hormones put you into that panicky fight or flight, and that exacerbates, makes worse your anxiety. By the way, I'm going to put up a link to a video where I talk about more of this because I discuss this in various detail in other videos. So we're going to put up a link for you. But the key here is that the vagus nerve, getting back to that one, it runs the parasympathetic nervous system, as I mentioned. And the parasympathetic is your rest, digest, relax. So when you're digesting food, you want parasympathetic to be in control. You want to digest well, you want to relax, everything's calm. But when this process happens, this hiatal hernia type of activity, and the stomach's getting compressed and then the diaphragm can't move well, you shift away from your parasympathetic into the sympathetic, the fight or flight, you see? And so it's the wrong messages are occurring, and now your diaphragm's in spasm, you're anxious, you can't get a deep breath, your heart's palpitating. So that's this whole cascade of symptoms that occurs, and at the root of it is a digestive imbalance. Whether you have a full-on hiatal hernia, whether the stomach is above the diaphragm or it's just pushing into the diaphragm because of pressure, that's the cascade that I'm describing here that might very well be you. So what are the causes? If you're somebody who has acid reflux, that can cause that irritation into the stomach and esophagus and have that reflex into the heart. You can be somebody who has too much belly weight. It's called visceral fat. And that creates constant pressure. And it's the pressure on the stomach that causes it to be constricted, bring its acid up your esophagus, compress it, and elevate it into the diaphragm. This whole cascade happening from that. You can have a poor diet, a lot of ultra-processed foods, fast foods, sugar, alcohol, and that kind of diet will create too many bad bacteria in your colon, in your overall digestive tract. And that creates, the too many bad bacteria create the pressure and the inflammation, creating the pressure on the stomach and the whole cascade we've been discussing. So we have several things that are causing this. Also, you can have constipation. You can just have somebody who's not moving their bowels the 1 to 3 times a day that they should be. And yes, that is what's normal. 1 to 3 times per day, not per week. So you can have constipation, that backup of the stool and the toxins that need to be excreted also lend themselves to more bad bacteria, more pressure. I mentioned the bad diet. Sedentary. If you're somebody who's very sedentary, you're not getting the good movement through your digestive tract that needs to occur. So it's great to get up and take a walk after meals. Try to get more active. That will help with the weight loss if you need to lose weight. So these are some of the strategies. The nice thing is that the protocols, you want to find somebody who's very adept at understanding this condition and can tell you what to do. But I can tell you from my viewpoint, what's great about it is the protocols are all natural. We're not talking about drugs or surgery. Now, certainly there are large hiatal hernias where part of the stomach is above the diaphragm, and that can require surgery. So that's not what I'm talking about. I'm talking about these small hiatal hernias or even subclinical, as I call them, meaning that, again, that stomach's pushed up against the diaphragm. It hasn't gone above it. So there's a lot of natural measures you can do, and try those first, finding a clinician who can help you with this. But I hear so often this occurring, and too often people end up on medications because they do start to doubt themselves, medications that are for anxiety or depression, because this goes on long enough and you start to get depressed. You're very, it's a very anxiety provoking problem. I hear from patients all the time. It's like, well, sure, I've been to the ER 3 times and they've told me my heart is fine. So is my cardiologist. But then it happened again. And then I think to myself, well, what if this time it is a heart attack? It's not a fun place to be. And so I want to share this with you, for maybe somebody you know who's been suffering with this, because it is something that's not too difficult to fix naturally. And so I wanted to share that, and I hope you found this informative. Please share it with another if that's pertinent. If you liked it, like the channel, subscribe, send me a comment. I love your comments. I answer all of them, and I look forward to speaking with you soon.